In March 2020, following the registration of the first case of COVID-19 in the country, and at the request of the government of the Kyrgyz Republic, the Disaster Response Coordination Unit, or DRCU, was activated. The DRCU was established in 2008 to enhance cooperation and coordination between the government, the UN, Red Cross and Red Crescent movement, and other key actors for effective humanitarian response to emergency situations. Under the leadership of the UN Resident Coordinator and the Ministry of Emergency Situations, the DRCU developed a plan of action on early recovery, health, education, food security and logistics, protection, water, sanitation, hygiene, and non-food items. 74 organizations were involved in the work of DRCU, and $75 million were mobilized for the support in the immediate COVID-19 response. The key results of DRCU in 2020 include 6,382 staff of the Ministry of Health and Healthcare workers have been equipped with knowledge on various aspects of the COVID-19 response. 964,858 items of essential equipment, PPE and other supplies have been procured and distributed among the healthcare facilities and vulnerable groups. 4,600 metric tons of food assistance provided to 260,000 vulnerable people. 100 metric tons of seeds, 218 metric tons of fertilizers, gasoline and wheat flour distributed to farmers. 216,697 preschool children, 1,180,330 primary and secondary school children, 26,716 primary vocational school students, 82,378 secondary vocational school students, 165,400 higher educational institution students continued to learn via remote learning tools. 250 teachers and local trainers of all educational levels built their capacity for providing and monitoring remote learning. 11,916 of the most vulnerable children, including children with disabilities, received psychological and pedagogical support during quarantine and or remote learning. 400 people per day have been receiving consultations by the 153 staff of hotlines, 111 and 112 during April and November. 320 people received the consultation from the crisis centres. 9,000 dignity-hygiene kits were provided to observation points and vulnerable people, such as the elderly, persons with disabilities and migrants. 4,000 children with disabilities received psychosocial support. 182 representatives, including 173 women, of administrations and departments of family and child support from Bishkek, Chuy and Osh oblasts, increased capacity on gender equality and gender-based violence prevention. 197,645 vulnerable people have been equipped with hygiene equipment and materials. Water and hygiene facilities were rehabilitated at 396 schools, 32 COVID-19 designated hospitals and 10 mobile units are being supported for health and waste management. The sector approach helped to ensure coherent and effective response and avoid duplication for the mobilization of the government and international organizations. The phase of the humanitarian response to the COVID-19 pandemic under DRCU coordination and response has been completed, and the DRCU will continue activities according to its core mandate and role, emergency preparedness and response.